We see that the viewers of our channel liked our videos about diagnosing diseases by tongue, navel shape, face, body, hair, eyes and feet. So today we will continue this topic, and in this video we will tell you about diagnosing diseases by the condition of the nails of hands and feet. This material is informational, always consult your doctor. What changes can speak about health problems? Most often only by the appearance of the nails cannot be diagnosed, but you can suspect some health problems that require a more thorough examination. Item 1. Black streaks. Dark or black streaks are called melanonychia. They are very common due to various causes. It can be a fungus, an injury, or a variant of the norm in dark-skinned people. The most severe diagnosis is rarely a subnail melanoma. It can be indicated by such signs: the band appeared in a light-skinned person, the band has changed in appearance, for example, some area has darkened, the border has become blurred, the lesion is only on one nail, especially on the thumb or index finger, pigmentation has spread to the skin around the nail, the width of the band is more than 3 mm, there were cases of melanoma or dysplastic nevus in the family, the nail plate looks strange or destroyed. What to do? Be sure to see a dermatologist to rule out melanoma. This is very serious, so it is better not to delay. The earlier the diagnosis is made, the better the patient's chances of survival. Item 2. White dots and streaks. White spots on the nails are called leukonychia. They usually appear due to nail trauma, less often due to skin and fungal diseases, taking certain medications, chemotherapy, or ingestion of heavy metals. If the trauma is repeated, for example, in those who constantly damage the cuticle, then, in addition to dots, there are perpendicular ridges and furrows, the nail begins to resemble a washboard. What to do? Be careful with your nails, try not to traumatize them. Item 3. Deep transverse stripes. These stripes are otherwise known as bowlines. They occur when something has slowed down the growth of the nails. This can be due to severe illness with high fever, scarlatina, measles, epidemic mumps and pneumonia, uncontrolled diabetes and other diseases that damage blood vessels, trauma, chemotherapy, severe stress, zinc deficiency. What to do? If you don't understand what caused your bowlines, you should make an appointment with a dermatologist. Usually, once the cause disappears, the nails will repair themselves. Item 4. Small pits. Small pits on the surface of the nails, like a thimble, usually occur with psoriasis. They can also be due to autoimmune connective tissue diseases such as Reiter's syndrome, inflammation of the joints, genitourinary system, and conjunctiva of the eye, focal alopecia, or baldness, and other conditions. What to do? Depending on the condition, follow-up with a dermatologist or rheumatologist is needed. You should start with a skin doctor, and he or she will refer further if necessary. As treatment makes the disease less severe, the condition of the nails may also improve. Item 5. Excessive thickening and deformity. Nails look like bird claws due to onychographosis. This is a severe deformity in which the nail curls up. It very rarely happens due to congenital diseases. It usually happens in elderly people who cannot take care of the foot. Onychographosis can be associated with conditions such as skin diseases in the history, ichthyosis, psoriasis, vesicles, poor blood supply, for example due to diabetes, traumatic damage to the nail bed, microtraumas due to unsuitable shoes, valgus deformity of the foot. What to do? You need to make an appointment with a dermatologist who will teach you how to properly care for your nails, prescribe creams to reduce this coarsening, or remove the deformed nail. Item 6. The nail is pulling or flaking off. If the nail begins to lift and peel off the finger, this is called onycholysis. This happens because of fungal infection, psoriasis, trauma, for example, after an aggressive manicure, cleaning the space under the nail with sharp objects. What to do? You need to make an appointment with a dermatologist to get tested for fungus and rule out an infection or inflammatory disease such as psoriasis. The doctor can also advise you on how to grow a nail faster. Item 7. Spoon-shaped curvature. Spoon-shaped curvature is called cholonychia. It most often occurs with iron deficiency, stomach or intestinal problems, gluten sensitivity, prolonged exposure to high altitude. What to do? You need to find the cause of the condition in order to treat it. Nails are only one of the external changes, probably not the most dangerous, and other symptoms can make life difficult. Item 8. Clock glass-shaped curvature. In some people, nails from birth may appear round and slightly curved at the bottom. But sometimes these changes occur over the course of a lifetime. In parallel with the rounding of the nails, the fingertips swell and the fingers themselves become like drumsticks. This is already a more serious sign, which can indicate severe chronic diseases, lungs, heart, liver, stomach or intestines. What to do? Usually nail changes are not the first symptom after all, and the person already knows about his diagnosis. In this case, you should see your doctor. Perhaps the changes in the fingers indicate a worsening of the condition. If there is no diagnosis yet, make an appointment with a general practitioner. Item 9. Color change. The nail plate can change color from a healthy pink to some other color. For example, if there is not enough oxygen, the nails may turn blue. If they turn pale, it could be anemia. And if they turn yellow, nail infections or lung disease. What to do? See a general practitioner or dermatologist and look for the cause of the changes. Item 10. Changes in the lunula. The lunula is a light-colored band at the base of the nail. It is best seen on thumbs, but on others it may be very small or absent. There are no specific norms for its size, so it is easier to compare it with other nails. If the hole on all fingers seems large or on one hand is larger than on the other, perhaps the cuticle is often traumatized. If the well, even if not very bright and noticeable, takes up 2/3 of the nail, they say Terry's nails. They develop due to aging, kidney failure, liver disease, congestive heart failure, diabetes. A red well can be a symptom of lupus, a severe autoimmune disease, heart disease, focal alopecia, arthritis, or dermatomyositis, an autoimmune disease of the skin and muscles. The wells may also turn blue. This is due to chemical poisoning or Wilson's disease, a rare inherited disorder of copper metabolism. What to do? It is necessary to take proper care of the nails, so that they are not traumatized. You also need to see a therapist in time, if there are any diseases of internal organs. Item 11. Brittleness and thinning. Thin and brittle nails are not always associated with vitamin deficiency. Perhaps your hands are too much time in water, damaged by chemicals in nail polish remover or cleaning products, or often overcooled or overheated. What to do? Protect nails from harsh chemicals and prolonged exposure to water, and file regularly to avoid splitting. On the recommendation of a dermatologist, you can take supplements with biotin. What not to do to avoid spoiling your nails? To avoid spoiling your nails with your hands, you should try not to traumatize them. Do not cut the edges of the nail too deeply to avoid ingrowth. Do not clean under the nails with sharp objects. Avoid pressing tight shoes, especially during sports. Do not bite or pick your nails, cuticle, and the skin around them. Do not tear off burrs. Do not use harsh nail care products, for example, with acetone. How do I take care of my nails? Taking care of your nails is also about hygiene. This does not mean that they necessarily need to be painted in a salon. It is enough to take care of them regularly and not to traumatize them with excessive efforts. What you need to do for healthy nails. Wear rubber gloves with cotton lining if you are going to keep your hands in water for a long time or work with toxic chemicals. For example, when cleaning the house, use hand cream. Do not forget to rub it into the cuticle and nails. Trim your nails regularly with scissors or clippers. Clean the dirt under your nails with a soft brush. Trim any weakened or damaged areas to help your nails grow back normally. Check with your GP or dermatologist to see if you need any supplements, such as biotin. And what points of diagnosing diseases by nails do you know? Write in the comments, we will be very interesting. In the description under this video there are links to useful videos on this topic. Subscribe to our channel, put a like and watch these videos.